Tonight on the newest vaccine from Johnson & Johnson. It's 76% effective at protecting you from catching COVID-19, but doctors say that number only tells part of the story. Fox Carolina's Matt Kaufax live outside DHEC in Greenville for us. And Matt, some people are asking how this vaccine compares to the others.
Yeah, Tori, and that's a great question. For starters, doctors tell me that there is a lot that's very similar between the new J&J vaccine and Pfizer and Moderna, but there's also some things that make it different and unique. For starters, in order to get it, you only have to walk through doors like these here at the Greenville Health Department one time because it is a single dose. That single dose means that there's no need for a second appointment. Doctors tell me that if any of the three vaccines come available, you should take them. Dr. Helmut Albrecht, infectious disease expert at Prisma Health and USC, says all three vaccines offer the same thing: protection from getting really sick.
If you look at the most important endpoint, i.e., does it prevent severe disease, does it prevent hospitalizations, does it prevent deaths?
He says Johnson & Johnson checks all those boxes virtually 100%. In 3 large-scale studies, he says no one died from COVID after getting the J&J vaccine or even needed a ventilator.
The J&J vaccine uses an adenovirus. That is actually a virus, but there's no COVID virus or SARS-CoV virus in that vaccine.
Albrecht says the newest vaccine takes a common cold virus and a spiked protein from COVID, which is not live, and uses it to activate your immune system. This is different than the mRNA methods used by Pfizer and Moderna, but the bottom line, he says, is that it's just as effective.
There are differences more than true weaknesses, in my opinion.
Upstate allergist Dr. Emmanuel Sarmiento also adds the J&J vaccine doesn't have any new side effects other than those we already know about. But with J&J, they're less pronounced.
The adverse events are lesser. They have lesser fever, lesser pain, lesser body chills, body malaise, and also the allergic reaction is lesser.
Both he and Albrecht say no matter what choice you make, you can't go wrong. Strong words of endorsement from both doctors right there. Dr. Albright also told me that to compare all three vaccines really isn't fair because unlike J&J, Pfizer and Moderna were made before variants like the UK and South African versions of COVID existed, meaning those variants could have altered those effectiveness numbers that people seem to be so hung up on. He says much ado about nothing on that front because the severe sickness, what we really care about, hospitalizations, deaths, that is all preventable. And those vaccines have been proven to be effective against all the existing variants as well. In Greenville tonight, Matt Kaufax, Fox Carolina, the 10 o'clock news.